Hi, it's psychiatric section and next subject of our discussion is obsessive compulsive disorder or abbreviated as OCD. Double checking. Double checking things are pretty common for human behavior, like did I shut the door of the garage, for example. It's better to double check this and to reassure. How about the front door or the back door? Yes, we will do this checking and reassure ourselves about many things. But what if you feel compelled to do these multiple checks? Then it might be considered an obsession. And now, what if a patient or people do a certain ritual with these garage doors, for example, garage? Leaving the house each time, make sure that door is closed, and just after leaving the house, then that might be a compulsion. How about definition of obsessive compulsive disorder? It is a specific type of anxiety disorder that is characterized by these obsessions and compulsions, two components. Obsessions are recurrent and intrusive thoughts. When you're hearing obsessive, you should think about thoughts that are typically unwanted and tough to get out of the mind. These unwanted thoughts, like my house is unsafe, cause anxiety. For example, house is unsafe. And usually they lead to compulsions, which are actions. Second component, compulsion, is action, thought and applied action that might be performed to try and reduce the anxiety associated with obsessions. And this might be distressful, and imagine that these thoughts and rituals have a serious impact on someone's daily life, significant distress. Obsessive compulsive disorder is a common disease in the general population and occupy around 3% from general population, and it affects both men and women equally, and usually starts in childhood or in the 10 years. What causes obsessive compulsive disorder could be genetic or environment. If to talk about twins, identical are more common than non-identical. At the level of neurotransmission, central nervous system, serotonin play a role, and a known cause, of course, as medicine is developing and not knowing everything. Okay, let's talk in part about obsessions and compulsions. First one are obsessions. Many types as examples are given, like contamination, accidental harm to self or others, symmetry and exactness, need for perfection, and forbidden thoughts. Contamination or mean of fear or distress about coming into contact with dirty surfaces, germs, sticky worms, substances, and chemicals. Accidental harm to self or others mean fear of harming yourself or others. Symmetry and exactness, a need to have item ordered in a certain way. For examples, this one should be arranged so and not too often or in a chaotic arrangement. So I need to have items in order, in a certain ways. Children and teens with this type of obsessions are either anxious because it just doesn't feel right or because of a superstitious belief that something bad will happen. A need for perfection. Most of us are perfectionists, and this is a good thing in our life. But if it is exaggerated or in excess, it could be harmful. So some kids and teens feel a strong need for things to be perfect or right. For example, a child might be not able to start her or his homework until her books are all ordered in a perfect arrangement, or cannot turn in an assignment until she or he is certain it's perfect. Other kids struggle to tolerate it if something isn't 100% right, focusing on doing the right things all the time and thinking about every tiny mistake. It is terrible. And forbidden thoughts. Entering into adolescence is a time of sexual maturity, and most teens think about sex and sexual identity during this time. However, some teens, they are plagued with unwanted thoughts and images about being gay when they know that they are not, or thinking about engaging in sexual behavior that feeling upsetting and even repulsive to them. And compulsions or actions. Many examples as well, like washing or cleaning, checking, counting, taping, touching, rubbing, ordering, arranging, and mental rituals. For washing and cleaning, we have many types, like washing, like toilet rituals, excessive wiping. Grooming and tooth brushing, like brushing every tooth in a particular order and very well. Showering rituals, washing each body part a certain number of times, not only one or two times, or in a particular order only, with saving of consequences. And cleaning compulsions, rituals, and rules of how to do the laundry wash, to clean the bathroom or kitchen. Checking is these types of compulsions can involve checking doors, locks, or backpacks to make sure everything is safe and in order. Counting, taping, touching, or rubbing compulsions can involve counting, touching, or taping objects in a particular way. Some children and teens have lucky and unlucky numbers. They are dividing them into lucky and unlucky, and involves in their rituals, like needing to touch a door 5 or 10 times before leaving the room, and so ahead. Ordering and arranging. These compulsions involves arranging items in specific ways, such as bed sheets, stuffed animals, or books in the school locker or book bag. And mental rituals. For example, a teen might have a bedtime prayer that she or he is mentally repeating over and over again until it feels right. Okay, I gathered here many physical and behavioral symptoms, even emotions and thoughts. Now for the diagnosis and the new diagnostic and statistical manual for mental disorder, like 5th edition or DSM-5, gives specific diagnostic criteria to meet a diagnosis of obsessive compulsive disorder. First and foremost, they need to have the presence of obsessions, compulsions, or both. The obsessions and or compulsions need to also be time-consuming, often such that it produces distress within their social and work. With life, for example, taking 2 hours per day folding and unfolding clothes and then being late for work or for school. It's also important that obsessions and compulsions are not due to the physiological effects of a substance or another medical condition, another pathology. And finally, the apparent anxiety isn't better explained by another medical disorder. What thoughts can have patient, like I'm responsible for that accident? What if I get sick? What if I'm sick but I don't know? I cannot stand not knowing, so it's a bad thought that do not allow you to work properly and stay relaxed. How about behavior, extra toilet paper using and asking parents to buy for cleaning supplies, making parents washing their hands before making a meal many times and repeatedly. So repeating actions, avoiding touching doorknobs, handles, etc. for avoiding contamination with something unknown. Physical symptoms can also be manifested like dizziness, racing heart, shallow breathing, muscle tension, and so on. And emotions, as this disorder is a type of anxiety disorder, so anxiety, worry, fear, sadness, shame, and guilt. Of course, this pathology have some complications, like problems resulting from obsessive compulsive disorder may include the following: excessive time spending on engaging in ritualistic behaviors, health issues like contact dermatitis if you are cleaning too much your skin or hands, for example, difficulty attending school as you are consuming your time with anything that do not necessitate it, troubled relationships, overall poor quality of life, and also suicidal thoughts or behavior could be present. And treatment, the most important is psychological therapy, called cognitive behavioral therapy, which helps a lot and helps a patient to face fears or obsessions, thoughts that are present and do not allow patient to do the daily tasks, putting them right and familiar with them and trying to avoid doing them. But for medication, we can address a patient to SSRIs medications, which are selective serotonin reuptake inhibitors, which working very well, but need 2 weeks at least for having some effects, and to around 2 months for establishing a normal effect. And also you should take at least 5 to 6 months for normal treatment and get a effect life prolonged. Thanks for your watching. Hope this video is useful for you. Please sign for a subscription and have a great time, guys.